Have you been told that you have high cholesterol? If so, you've probably been told that this puts you at risk for heart disease. Maybe your doctor has told you that you need to go on a statin drug to lower your cholesterol. How do you decide if this is a good idea? And are there natural alternatives to medications for high cholesterol? I'm going to be briefly tackling these topics today. My name is Rachel. I'm a nurse practitioner who is passionate about natural medicine that really works. First of all, what is cholesterol? Cholesterol is a substance made by the body that is found in all of your cells. It is essential for life. Everyone talks about how high cholesterol is bad for your health. We will talk about if this is true in a moment. But we do know that low cholesterol is bad for your health. Here are just a few reasons why cholesterol is important in the body. It makes up part of the cell membrane. It helps digest fatty foods by being made into bile salts and acids. Hormones, especially the sex hormones such as estrogen and testosterone, are made out of cholesterol. Cholesterol also fights infections and parasites. The sun converts cholesterol to vitamin D. Cholesterol levels below 180 actually increases your risk for hemorrhagic stroke, depression, and suicide. Studies have even shown that low cholesterol in the elderly increases the risk of early death. So, now that we know how dangerous low cholesterol is, what about high cholesterol? The truth is that just looking at cholesterol and focusing on lowering it is not very helpful in preventing heart disease and heart attack. As always, we want to find the root cause of why cholesterol is high. It is helpful to look at the different components of cholesterol in order to do this. Most people know that cholesterol can be split into LDL and HDL cholesterol, but there are other cholesterols as well. LDL stands for low-density lipoprotein. Some people call this bad cholesterol because it transports fatty acids from the liver to the tissues and cells of the body. HDL stands for high-density lipoprotein. Some people call this good cholesterol. It transports fatty acids from the tissues to the liver to be made into bile salts. The truth is that these cholesterols are neither good or bad. You do want your HDL cholesterol to be above a certain number, but if this number is too high, it also indicates that something is not working properly in the body. Many doctors also focus on getting the LDL cholesterol lowered, but this is also not very helpful for your health. If cholesterol is not a major risk factor for heart disease, what is? Most people know about the major risk factors, such as smoking, lack of exercise, or a sedentary lifestyle, obesity, high stress level, and excess alcohol intake. Some other risk factors that may not be as well known are a low ratio of HDL cholesterol to total cholesterol, high triglycerides, chronic inflammation, excess insulin, elevated VLDL level, and increased small LDL particles. So although total cholesterol levels and LDL levels don't really tell you much, there is other blood work that can be helpful. In conventional medicine, high cholesterol is demonized and your doctor will likely prescribe a medication to lower it. There are a number of medications prescribed for high cholesterol, but the most common classification of drugs are statins. Statins certainly do lower cholesterol, but they don't lower or eliminate your risk for heart disease and heart attack. Consider carefully before agreeing to take them, because there are a lot of dangers associated with statins. Statins increase your risk for a number of chronic diseases, such as diabetes, congestive heart failure, stroke, Alzheimer's, Parkinson's, and cancer, especially breast cancer. Some of the most common side effects that I see with the use of statins are muscle and bone pain. Statins can cause breakdown of muscle tissue and muscle damage. Another important fact to know about statins is that they block and deplete the production of CoQ10. This is a coenzyme and antioxidant that the body makes and is needed for energy production for our cells. A CoQ10 deficiency comes with a whole new host of risk factors, including heart disease and nervous system disorders. So, if you are on a statin, it is very important that you also take a CoQ10 supplement. Ubiquinol is an active form of CoQ10 and is efficiently used and absorbed in the body. If statins are not the answer, what is the best way to prevent heart disease and lower your cholesterol naturally? You can do a lot to prevent heart disease just through your diet. Switch out your vegetable and commercial oils for healthy fats. Eat plenty of olive oil, avocado oil, and coconut oil. Avoid those trans fats and unhealthy oils in the form of fried foods and fast foods. Reduce refined carbohydrates and sugar in your diet. Limit processed foods as much as possible. And eat plenty of vegetables and fiber. It can also be helpful to reduce or avoid fruit juice in your diet, especially if you have been told that you have elevated triglycerides. There are also simple activities you can do to improve your heart health. Get plenty of sunshine. Sunshine has been shown to raise HDL cholesterol and possibly even lower total cholesterol. And get plenty of sleep. If you are still concerned about high cholesterol after making these changes, there are plenty of supplements and herbs that can help you lower it naturally. Berberine is a great option because it increases LDL receptors. Garlic, bergamot, and green tea can also lower cholesterol. But remember, lowering cholesterol is not really the goal for heart health. If you are really concerned about your risk, there are other components of cholesterol and other blood tests that are more important to look at and monitor. And of course, making healthy choices in what you eat is the most important step you can take in preventing heart disease.